All right, man, peace. So, one of the things that we really have to talk about going into 2025, which I think a lot of the American citizens, let alone the world, knows already, is that there might be an impending new pandemic that might be here before our eyes, and this pandemic is told to be 10 times worse than the first pandemic that happened, and that a lot of this is coming off the backs of usually animals such as birds, and usually birds is the main culprit of this new airborne pandemic that's supposed to be happening, these pathogens that's being found, and they're mutating from birds, and then it's being spread into curious things such as cat food and dog food, and that needs to be on a watch, and it's a recall on all that other stuff already. Regardless of how you want to picture everything that's happening, it is an inevitable feeling that some new pandemic is going to be happening. But it's just what I'm curious about is what is the government going to do this time besides what happened last time where they forced inoculations on everybody and told them you're not going to be able to live a fruitful or healthy life if you do not take this inoculation and you do not abide by what we say is the safest measure that we should do based on quote unquote science. So I'm going to play this CNN video. I won't give any commentary on it. I just want you to watch it, and then I'm going to read an article to you guys and give my commentary along the way. So, Pete.
It could become infectious to humans even if it's not coexisting with the human flu, right?
Well, if it mutates like it did in this
Yes,
individual,
like in the Louisiana
or
case.
in the case in Canada, but that sometimes is a random, slower process.
Okay.
But if you have that co-infection, then you can share genes.
Okay.
And that's a really, to me, the spring and the summer where we had all of the dairy cattle to farm worker exposure, we didn't have human flu circulating. So now we're entering a much more dangerous period, yet we're still not testing. And we should be providing tests free of charge to dairy farm workers so they can test anonymously weekly, because they'll want to know if they have both cases of potential flus co-circulating in their own body to protect their families. People are very smart. I find the American public to be incredibly smart. If you tell them the risk and you give them the tools, they will utilize them to protect themselves and their family.
So, given this double whammy that you laid out, do you think it's just a matter of time until there's just a full-fledged pandemic here?
Well, certainly we're setting ourselves up for that potential, which, I flash back to January of 2020,
Right.
and I'm hearing the same words come out of the CDC.
Like what?
Low risk of human-to-human transmission. Didn't we hear that from the WHO and the CDC about COVID? So I think our way through this is to use 21st century technology. Remember, it was the private sector that gave us tests within weeks. We went from 20,000 tests to 2 million tests. So if we got the private sector engaged in our response, they would help us get tests out to all of the dairy farms, all the poultry farms, where they could test both the chickens and the people exposed to the chickens, and then we would know how far spread this virus was. Right now, we're just looking for symptoms again. We should never be tracking viruses through symptoms. You don't see a virus through a symptoms. You see the virus through the test. And we know from COVID, most of the spread was asymptomatic. If we had been testing in January, as many other countries were, we wouldn't have had the spread that we had. So I'm hoping we learn from.
But it sounds like it doesn't. It sounds
That's why
like
I'm
from what
worried.
you're laying
Yes.
out, you don't think this
We
country
did
has
not.
learned from the COVID pandemic.
Our
And there's not a sense of
agencies-
urgency right now
Our
that should match
agencies
the
are
moment.
making the same mistakes they made with COVID. The number two principle of pandemic is detect. And the only way to detect for viruses is to test. You cannot see a virus through symptoms. You miss so many cases. Yet we're still talking about flu-like illness. Well, there is no flu-like illness. There's RSV, respiratory syncytial virus that causes croup. Parents know what that is. There's mycoplasma pneumonia circulating right now. There's flu circulating right now, and soon there'll be COVID circulating. Those are all coughy respiratory illnesses that look the same. We should not be tracking illnesses by symptoms. We should track them only by testing so that parents know whether their child has RSV or flu so they can protect their grandparents. And the grandparents can know whether they have RSV or flu or COVID because flu and COVID are treatable. So we need diagnostic tests out there. Mm-hmm. And I know if CMS tomorrow said, you know what, we're not going to pay for that doctor's visit unless you have a definitive diagnosis, we'd have better respiratory tests within 4 weeks because our private sector will respond. If there's a need and there's a way to be reimbursed, they will make the product.
And I want you guys to pay attention to that. Likely, I'm going to be doing some videos towards this topic of conversation about what I usually call Karina, in which I'm going to be giving an estimate about how there has been a lot of lies that's been unpacked. There has been a 500-page report that was given off at a federal office where they had a conversation about what they have learned from the previous pandemic and what they intend to do for the next pandemic that is awaiting. So a lot of people play it like, well, the higher uppers play it like, well, right now it's nothing to be worried about, or we're just tracking it. There's something going on, but the mutations are starting to spread and all this other stuff. And there's been so many warnings because of the past couple of years. When the first pandemic was starting to die down, there was a lot of these different mutations or pathogens that was found on the West Horn of Africa. And then a couple of places with here in the United States they sat up there and said, oh, that you have to be on the lookout for it. But most at the time, usually now that we're talking about pandemics or what we say the viruses of those pandemics are entailing, you usually have to pay attention the time of year. See, when they had a lot of these pathogens and mutations that went out during the summertime, it wasn't really likely to pick up steam with a lot of American citizens because of the moisture that was in the air and because of the hot temperatures that would kill down a lot of the viruses that was out there versus the dry air that you get during the wintertime. And the fact of the matter that a lot of these particles can be widespread and then get into humans easily. We also have to pay attention to what they are now proposing as the H5N1 strain of a new virus that is the bird flu. And as you know, the last time prevalently we've known about the bird flu was from 2009, the H1N1. So now upgraded to the H5N1, what entails off of there. So let's check out this article that we need to pay attention to. Let's check it out. And so it's going to say, just setting itself up for another pandemic tells you more than likely there is going to be a new pandemic that's going to happen. But let's check this out. The U.S. hasn't learned lessons from the CV pandemic that it could use to mitigate the threat of pathogens like H5N1 bird flu that keep showing signs of their own pandemic potential, health experts told CNN Friday. We kind of have our head in the sand about how widespread this is from the zoonotic standpoint, from the animal to human standpoint. Dr. Deborah Bricks, the White House CV response coordinator under President Donald Trump, said on CNN Newsroom with Pamela Brown. And just off topic real quick, President Trump or Donald Trump hasn't even been inaugurated yet. And already they're starting to say President Donald Trump. We still are dealing with President Biden right now and his vice president, Kamala Harris. So, I mean, it's just something that came up to mind. It's just like he's not even president yet. He's not president until he gets inaugurated January 20th of 2025 or around that time. So why are we already calling him president? That's just something I wanted to think about. Bricks called for much wider spread testing of farm workers who make up the majority of identified cases in the U.S., noting the country is heading into an even higher risk period as seasonal flu begin to circulate. That raises the possibility a person could get infected with both seasonal flu and H5N1 and the viruses could swap gene segments, Bricks said. Given the bird flu virus, more tools to better infect humans, a phenomenon known as reassortment. And the thing about it is when they had that whole entire thing that I think a lot of people should pay attention to is the whole entire thing about airborne. In my opinion, or this we already know is a fact, the air that we're breathing in and all this other stuff is very tainted. It's very fucked up. And, maybe a lot of people will not talk about it, but it's not natural. That's why I have the stigma to believe that a lot of urban areas, such as my city of New York, is going to be impacted with a high level of infected patients. And other places where there's people on top of each other, it's too easy for this stuff to widespread. Now, farmers, when they have the farmland, that's a catch 22, but it's also about the cattle and the animals being affected because animals aren't going to be treated the same way that humans are going to be treated when it comes to a disease. A spokesperson for the U.S. Centers for Disease Control and Prevention pushed back on Friday, telling CNN in a statement that the comments about avian flu H5N1 testing are out of date, misleading, and inaccurate. Despite data indicating the asymptomatic infections are rare, CDC changed its recommendations back in November to widen the testing net to include testing asymptomatic people with high risk exposure to avian flu. And during the summer, it instructed hospitals to continue subtyping flu viruses as part of the nationwide monitoring effort instead of the normal ramping down of surveillance at the end of flu season, the spokesperson said. The results, the result, more than 70,000 specimens have been tested looking for novel flu viruses. More than 10,000 people exposed to avian flu have been monitored for symptoms, and 540 people have been tested specifically for H5N1, the spokesperson continued. Additionally, CDC partnerships with commercial labs mean that H5N1 tests are now available to doctors' offices around the country, significantly increasing testing capacity. The CDC added it has a seasonal flu vaccination campaign underway for farm workers in states with infected herds to help protect them from seasonal flu and to reduce the chance of reassortment with the H5N1 virus. The agency has also said there's currently no human-to-human spread of H5N1, but risks continue to emerge that the virus could evolve to more easily infect people. The CDC reported Thursday that a genetic analysis of samples from the patient in Louisiana recently hospitalized with the country's first severe case of H5N1 showed the virus likely mutated in the patient to become potentially more transmissible to humans, but there's no evidence the virus has been passed to anyone else. The patient was likely infected after having contact with sick or dead birds in a backyard flock. The CDC said earlier this month in its Thursday analysis. The agency said the mutations it identified in samples taken during the patient's hospitalization weren't found in the birds, suggesting they aren't in the virus widely circulating in wildlife. The mutations, similar to ones observed in hospitalized patients in British Columbia, Canada, may make it easier for the virus to bind to cell receptors in humans' upper respiratory tracts, the CDC said. The changes observed were likely generated by replication of the virus in the patient with advanced disease rather than primarily transmitted at the time of the infection. The agency said, although concerning, and a reminder that H5N1 viruses can develop changes during the clinical course of human infection. These changes would be more concerning if found in animal hosts or in earlier stages of infection, when these changes might be more likely to facilitate spread to close contacts. And the funny thing about it is that when we're talking about animal host, there's been a lot of these articles that's been talking about there's recalls on cat food. And therefore, through that cat food is exposing the cats to this type of rare H5N1 type of generated cell or whatever you want to call it for it to expose the cats to this disease. They catch the disease, and because it's the pets of the humans catch the disease from the cats. That is the likely thing that they're putting out there for the media to consume and say, hey, this might be one of those sort of things we need to look out for, because if the cats get it, the humans get it, because those are domesticated animals. And so therefore, they have no choice, and then it's all that type of stuff. But let's continue. The CDC emphasized the risk to the general public has not changed and remains low, but said the detection of the genetic mutations underscores the importance of ongoing genomic surveillance in people and animals, containment of avian influenza, AH5 outbreaks in dairy, cattle, and poultry, and prevention measures among people with exposure to infected animals or environments. The analysis found no changes associated with markers that might mean antiviral drugs wouldn't work as well against the virus, the CDC added, and noted that samples are closely related to strains that could be used to make vax if needed. The sequences also didn't show changes in genes associated with adaptation to mammals, the CDC found. The patient was infected with a strain known as D1.1 that's closely related to viruses circulating in wild birds and poultry in the US. Another strain known as B3.13 has been spreading wildly in dairy cows and hasn't been found to cause severe disease in humans in the US. While this sounds like good news, the H5N1 situation remains grim. Dr. Angela Rasmussen, a virologist at the Vaccine and Infection Disease Organization at the University of Saskatchewan in Canada, posted on Blue Sky on Thursday. There has been an explosion of human cases, she said. We don't know what combinations of mutations would lead to a pandemic H5N1 virus, but the more humans are infected, the more chances that a pandemic virus will emerge. The CDC has confirmed 65 cases of H5N1 bird flu in humans in 2024. Of those, 39 were associated with dairy herds and 23 with poultry farms and culling operations. For 2 cases, the source of exposure is unknown. The severe case in the Louisiana is the only one associated with backyard flocks. Dr. Paul Offit, a vaccine scientist at Children's Hospital of Philadelphia, noted the CDC said the mutations may enable the virus to bind better to cell receptors in humans' upper respiratory tracts, not that they clearly do. I like to see clear evidence that it binds well. Offit told CNN Friday, there hasn't happened yet. And more importantly, Offit added, there's not the clinical prevalence that you see human to human spread. The spread among animals like cows, though, has some health experts on high alert. Since the virus was first found in cattle in March, outbreaks have been detected in herds in 16 states. This month, the United States Department of Agriculture began a national milk testing program to track the spread of the virus through dairy cattle, and the agency has thus far brought on 13 states that account for almost half of the country's dairy production. The program requires that raw milk samples be collected before the pasteurization process and shared with the USDA for testing. Government agencies say pasteurization inactivates the virus, making pasteurized milk safe to drink. The Food and Drug Administration and other health agencies warn consumers not to drink raw milk, not just because of the risk of H5N1, but also E. coli, Salmonella, and Listeria. That the H5N1 virus has already spread to so rapidly among cattle, though, suggests the USDA has basically dropped the ball big time, said Dr. Michael Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota, in an interview with CNN Friday. I think it was out of fear to protect the industry, and they thought it was going to burn out, and it didn't. Osterholm also said the US and others around the world should have done more to examine lessons from the CV pandemic and to accelerate work improving flu vaccines. And he noted, you got the new administration coming and saying they're going to do in infection diseases research for the next 8 years, referring to comments made by President Trump's nominee to lead the U.S. Department of Health and Human Services, Robert F. Kennedy Jr. Austin Holmes said his risk assessment for H5N1 hasn't changed as a result of the Louisiana findings this week, but that he's always concerned about the threat pathogens like the bird flu virus pose. The pandemic clock is ticking, Austin Holmes said. We just don't know what time it is. So that's just to warning people of what can be coming up soon with this new pandemic that they're prophesizing to happen, a lot of which happened the same type of way that the last pandemic happened. Obviously, we understood that, in which it was airborne, but at the same time testing out the lab and saying that it came from bats. Allegedly, that was being told how it came about. But at the same time, this whole entire thing being on the back of the bird flu, and ironically, me is Bronzebird, right? But just the idea that this is something that we need to be very aware of and to just monitor as time goes on. And as usual, they say, hey, you got to stock up, you got to make sure everything is everything. But how are they going to handle this pandemic if it is to allegedly happen? You understand? And otherwise than that, a lot of the cattle's being affected, poultry and all these different things. I can only imagine that there are two things is going to happen. Either way, they're going to find some type of alternative way of serving and supplying food. Or number two, there is going to be an increased food shortage based on the production of poultry and cattle, because it includes beef, chicken, and probably other animals out there affected by this H5N1. And especially because it's the bird flu, especially chicken. But otherwise than that, give me your thoughts in the comment section. Remember to like, share, and subscribe. Peace.